Okay, so we'll go ahead and get started. Welcome to another one of our brief team sessions. Today we're going to be talking about visible body and some of the animations that are available. I'm not sure if somebody's got their microphone on or not. I'm hearing an echo, but we're going to be doing a presentation today on visible body and some of the animations that are available for pathologies and muscle movements, and there's animations available for patient information, all kinds of things available. This will probably be a shorter presentation, but it's kind of a targeted thing I wanted to show people that was available, and a resource that you may have used before for anatomy, but maybe weren't aware of some of the things that were available in this. So again, we're going to be talking about animations, pathologies, and things that are available in this resource. There's muscle actions that you can study in this. There's patient education animations, so I can see how this could be used in a way with interactions with patients if you're trying to explain processes or something, some kind of condition that you're trying to explain to a patient. There's advanced animations that might not be necessarily used with a patient, but could be used more for students for study. You can search for, there's a few animations for pathologies that are available, and you can search for those that are available. And they also attach animations to content, so it'll be related content. I was going to show like an example of alveolar sacs. I'm not sure if I'm pronouncing that correctly, but you'll see, like, if you're searching through particular kinds of content, like we're looking through microanatomy, you'll see there'll be animations attached as related content to that. So to show you this resource, again, I want to show you where this is on the medical library page. Underneath databases. This is available in the research guides or the A to Z medical databases. We have it linked there, but it's also the last link here underneath databases for visible body. And when you launch that, you actually have to pull up a screen for visible body, and you'll launch the Human Anatomy Atlas, and it actually launches this application. It's a Java application, I believe, but it launches this visual grid where you can pull up regions and systems, nervous system views, respiratory systems. If you've ever used this for studying anatomy before, you might be somewhat familiar with what's available here. And all these are 3D views that are, you can manipulate these and move them around. But you may not have looked at some of these media that are available. And you'll see that there's media animations available for bones and skeletal systems, cells and tissues, respiration and circulation, nutrition and elimination, system overview. And here's some of these respiratory and circulatory pathologies. So I think this is kind of cool. I mean, we talk about anatomy resources as studying normal anatomy, but I think it's kind of cool to be able to study some of these pathology processes, ischemic stroke, pulmonary embolism, and see what's actually happening in the anatomy with those pathologies. But something I wanted to point out with first, let me go back here. Oops.
Rob, it's Dr. Brands. I'm not sure we've got access to the whole menu that you do. I'm on the site, and it looks like a number of the icons are grayed out. But could you check on that for us?
Absolutely, I will. Absolutely,
okay, thanks.
Sure. But are you seeing what I'm showing you on my screen?
Yes, indeed. Thank you.
Oh, okay. Okay. So one of the first things I wanted to show, and this would be more of a normal anatomy study, is for these muscle actions over here under views for muscle actions. You'll see we've got head and neck, shoulder, upper limb, and thorax, spine and back. And again, this is more normal anatomy. But if we're looking at like elbow flexion here for upper limb, it'll actually pull up that upper limb and automatically start showing what the muscle is doing during that flexion of that elbow. And I can use this joystick to maneuver this model and look at that animation from a different view and see what that muscle is contracting during that elbow flexion. I mentioned there's related content I was going to show for some other content that's available in here. But you'll see there's actually related content here. There's other media content available for this. So if I click on this, There's a video here.
Movement of the skeleton often involves pairs of muscles that perform opposing actions,
You guys hear
like
that?
flexing and extending, or bending and straightening. Muscles involved in these paired actions are categorized as agonists and antagonists. A muscle that contracts to generate the main...
So you can see there's related media content available with this particular animation. So that's more for normal anatomy stuff that's available. Under this media, looks like a little play button here under media. There are patient education animations and then advanced animations. And this is where I'm thinking, you know, I haven't normally thought of visible body as being something that would be used in interaction with a patient for maybe our clinical faculty, but I could see how, you know, if we do have clinical faculty that are interacting with patients and you wanted to be able to explain to a patient, you know, a particular syndrome that they're dealing with, or some type of disease or process that you're trying to explain, I could see how this might be kind of useful. I mean, it might be more information than they really need, but I mean, I'm trying to think of like example, like this ACL tear. This is kind of neat to me. I mean, I've actually had my ACL replaced.
The knee joint contains bones, muscles, and ligaments which flex, rotate, or pivot during normal range of motion.
Exactly.
A knee sprain can occur when a jump or sharp pivot twists or hyperextends the joint. The force can damage
what is happening anatomically. I think what might be kind of useful. And again, there's some of these pathologies available directly in here for patient information. So GERD, gallstones, diverticulitis are these animations that are available that they're more for patient type information that might not be necessarily appropriate for study for students. But there are some advanced animations available here that would probably be more appropriate for student doctor study. Concentration gradients, fluid balance. I'm not even sure what vasopressin is, but you can see how some of these are more pulmonary embolism that are going to be more advanced animations that are appropriate for probably student study, not necessarily for patient information or that kind of.
So Rob, I think my favorite is the one that showed the knife going through the tissue. Just so you know.
Well, I appreciate your. I think you took down your background. We should have kept that up. When in doubt, cut it out. That's
only until he has to call internal medicine for any post-operative support, right, Eric?
So.
Yeah, internal medicine has to back us up. You know, I'll hand you that.
So these are some of these advanced animations that are available, and then something else real quickly that I wanted to show was there's a whole set of animations of just pathologies, and you can actually click on that little search box and type pathologies up here. If I can, and I can find animations for UTI, COPD, asthma, pneumonia. I mean, it's not totally exhaustive, but there's quite a few here. I mean, pneumothorax, acute renal failure. I could see how this might be useful for students. I mean, neuromuscular disorders, Duchenne muscular dystrophy, to see animations of what's actually happening in these processes, chronic renal failure, to see an anatomical animation of what's actually happening in that process. So that's some of those that are available, animations that are available of those pathologies. Something I wanted to mention too, this is the last thing. Again, this is a pretty brief session. I wanted to show how even if you're looking at like a microanatomy level, you can find related animations to the content that you're looking at. So the example I was looking at earlier was these alveolar sacs, which I believe these are like your lungs, right? I think, yeah. So, or had to do with breathing. So if we're looking at these alveolar sacs, we can actually click on these and it can pull up this related content, kind of like we were looking at before with the other related content, and it'll pull up related content up here that you can actually click on this to play that animation.
During inhalation, air containing
explain the
oxygen
process.
passes through the nose and mouth
Anything
to the
related to
lungs.
those alveolar
During
sacs and what's
exhalation,
actually
air
happening.
containing carbon dioxide and other
microanatomy.
waste passes out the same path. This process of moving air in and out of the lungs is called pulmonary ventilation.
So you can see this is just another tool that we have available, and this is something that, you know, if you've taught some anatomy or Maybe you've been somewhat familiar with this, or maybe you haven't seen that this could be used. Maybe if your clinical faculty could be used in a way with that patient education and animations. They could be used with encounters with patients in a particular way, or maybe this stuff could be used with your lectures in some way. But I just wanted to do another brief talk today and just kind of show you some of the stuff that was available here. So thank you guys for joining for this today. Appreciate your time. And again, this is recorded, so I'm going to upload this to our research guide. And we have a growing library of these recordings. So if there's any others that you're interested in that you haven't been able to make it to, all of these recordings are available on our research guide for you to watch whenever you have time. So thank you guys for your time.
Thanks, Rob.
Absolutely.
Thank you, Robert.
Yep. Thanks, Rob.
Thanks, Rob.
Sure.
And thank you for moving it to 12:30 to give us more time after convo.
Absolutely, Dr. Emmett.